First impressions are priceless.
I'm Dr. Kenny Levine. For the past 37 years, we've been helping patients of all ages restore their smiles. Today, with modern technology and lasers, we're able to treat infants of 7 days old. We treat their parents. We help them not only keep their teeth, but restore function for the rest of their lives.
Call 954-603-7109.
Smiling is infectious, yes it's true. Please be careful or you'll catch it like the flu.
Good evening, welcome to Health Talk. I'm Dr. Kenny Levine, I'm your host and moderator. This is a news show in South Florida. We talk about medical issues, dental issues, wellness issues, emotional issues, psychological issues, anything that's going to make your life better from now and into the future. You know, I'm a periodontist. I treat gum and bone disease, used to be called pyorrhea, primarily for adults. But I want to give you a little story. About 2 years ago, on a Monday, I received a call from a dentist friend of mine, Danny, and he said to me that he and his wife had their first child, a little boy, on Friday. I said, Danny, I know that I called you on Friday. Actually, I called you Thursday to wish you good luck, and Friday I checked to see how you're doing. So how are you doing? He says, well, Mom and my baby are healthy, but the lactation consultant says that my son is tongue-tied. He's going to have trouble, and he is having trouble nursing. And he wanted to know, I want to know if you can help him. I said, sure, what does he need? Well, he needs a tongue-tie release. I said, tongue-tie release. Well, you know, I have a grandson, Michael, who's now 10 years old, but when he was a year and a half old, my daughter and son-in-law decided to have his tongue relaxed, and it was a half a day in the hospital under general anesthesia with 15 family members in the waiting room. I remember having discussion with my friends, including my pedodontist friend Dennis, before this to see when we should do this, and there was never really a good consensus of when to get it done. So Michael had some difficulty in nursing, and they took care of him in the hospital, but it was, again, half a day in the hospital under general anesthesia. So I said to my friend Danny, I said, of course I can do this. He says, can you do it with your laser? I said, absolutely. Bring your son in whenever you're ready. So he says to me, what are you doing on Friday? I said, what? He says, what are you doing on Friday? I said, well, I don't have any plans. He says, well, I'm bringing my son in. I'm bringing DJ in. So on Friday morning, Danny comes in with DJ and his wife, Mimi, and DJ is 8 days old. What we did was we swaddled DJ. Danny, being the dentist, the doctor, held him, and I used the laser. And with the laser, we were able to release his tongue tie in just a matter of moments. We did it without anesthesia, no stitches, no injections, no scalpel. The laser is light-activated energy. It enables us to dissolve tissue without bleeding, without pain, without swelling. We did the procedure, and I invited Mimi to come into my office, and she and DJ and Danny went inside. And she came out 10 minutes later, and she said these now infamous words, he can nurse now. Well, that was the start of a whole new career for me. Because to date, we've treated probably well over 100 of these infants who have difficulty nursing. Most of them are referred by lactation consultants, the ladies in the hospital who help the mothers learn how to nurse their babies, and they refer them to us. You know, there are more reasons to relieve and to correct a tongue tie other than nursing. Young children can have trouble with speech. As their dentition develops, if their tongue can't be raised up to the roof of their mouth, the roof of the mouth cannot expand, or the palate cannot expand, so they can develop crossbite relationships as their permanent teeth come in. So there are many reasons to do this. For me, for my staff, it's a joyful experience. We have little goggles. Little goggles are called itsy bitsies or teeny weenies. And our whole life is lit up when they come into our office, because we know that within a few short moments we can change the life of not only the baby, but the mom. When I met with the lactation consultants, they talked to me about the difficulty that mothers have, the pain that they go through when they're trying to nurse a baby who can't nurse properly. I'll be back in a moment. We're going to talk about one of my favorite topics, children. I'm going to talk with a very special guest. I'm Dr. Kenny Levine. It's Health Talk. It's streaming live on the web, www.tvchannel19.com. We'll see you in a moment. Thank you.
When you're smiling.
First impressions are priceless.
I'm Dr. Kenny Levine. For For the past 37 years, we've been helping patients of all ages restore their smiles. Today, with modern technology and lasers, we're able to treat infants of 7 days old. We treat their parents. We help them not only keep their teeth, but restore function for the rest of their lives.
Call 954-603-7109.